when we talk about deaths from COVID, it still seems heavily concentrated among older people.
Yeah, certainly. So deaths have actually increased amongst those, I believe, 65 and older. So if you're young and relatively healthy, you were likely to experience a mild to moderate course of COVID. I think one of the things that people still have to recall is that it's so prevalent in the community that the vaccines do reduce transmission. They don't eliminate transmission, they don't eliminate sickness, but they do reduce the transmission and they do mitigate severe disease. So it is right now more important than ever, actually, to make sure you're vaccinated and boosted, as some of our other tools have become somewhat limited. There's a significant shortage of monoclonal antibody throughout the US. There's essentially none left in the state of New York. And even Paxlovid, as wonderful as it is as a medication, has many, many contraindications. So as our tools to combat the pandemic dwindle somewhat in supply, we really need to make sure we make use of those that are available.
And now what about, I know that you and I read the same study about this idea of mixing your mRNA vaccines when it does come time to boost.
So this is certainly not a new concept, right? It has been available for many months now that you can mix and match or have what we call heterologous vaccines. This study we're referring to does show that for those who received Pfizer or AstraZeneca, which has not been very relevant in the U.S. experience, but certainly abroad in Europe has been more common, that those who received Pfizer and AstraZeneca, if they received Moderna, had more of a robust immune response, generated sort of a greater degree of antibodies, and in a smaller study had better clinical outcomes. But I should say, these studies are yet to be replicated, but it makes sense and reinforces the idea that there are subtle differences between even the mRNA vaccines, that the Pfizer and Moderna vaccines work somewhat differently, and there likely is some benefit in crossing over for your booster.